Um, Thank you guys for taking the time today to hop on our info session call. We're really excited to kind of share with you guys what we've done in the past, who we are, and also what we're going to be doing this upcoming year. Um, and we'll get started first with introductions from leadership. So I'll start first. So hi, my name is Joanna. I am a rising senior at Pomona, and I am one of this year's Draper Center coordinators. And if the other Draper Centers coordinators could introduce themselves before we give the rest of the leadership the time to introduce themselves, that'd be awesome.
Hello, my name is Emily, she, her pronouns. I am a rising senior at Scripps College. I am also one of the Draper Center coordinators. I was also one last year. But yeah, super excited to share all about Health Bridges with you all.
Hello, everyone. My name is Trisha. I'm also one of the Draper Center coordinators. Starting this year, I was a CP coordinator before, and I'm looking forward to telling you guys a little bit more about what we do. I'll go ahead and pass it on to Jason or Lily, whoever wants to start. Go ahead.
My name is Jason. I am a rising junior at Pomona College. I am the coordinator for hospital task. Um, I'm excited to answer any questions from you guys.
Awesome. Hi, everyone. I'm Lily, she, her pronouns. I will be a senior at Pomona, and I'm this year's Community Partnerships Pod coordinator. So, yeah, excited. Thank you, everyone, for being here. And I'll pass it to one of the Draper Center coordinator. I don't know who's going first.
It's me. But yeah, thank you
Okay.
guys for introducing yeah, thank you guys for introducing yourselves. And we'll get right started. So who we are and a little bit of background about how Health Bridges came to be. So Health Bridges was found in 2015 by three now Pomona alum who really wanted to transform the challenges that immigrant families had to face when navigating the healthcare system. Um, some of their stories kind of touch about being individuals who had to translate for their parents, learning how to navigate the healthcare system alongside their parents. Really touching story, honestly. And they wanted to create health bridges to help others who were facing similar struggles. Now, we do have a video, but it is a little bit of a lengthier video, and we want to give enough time for questions. But if you are interested in learning more about their stories and why they started, the video will be on the presentation, and I believe it's also on our website if you want to learn more. But yeah, that's such a gist of who we are. Now, more specifically with our mission, to want to preface, our mission has kind of expanded and grown these upcoming years, but to kind of just read it out for you guys. So Health Bridges is a student-run nonprofit organization that seeks to provide essential and culturally competent healthcare resources for low-income, limited English proficient, or LEP for short, and underserved individuals in the Inland Empire and Greater LA County. We have a diverse and dedicated team of multilingual, compassionate college students from the Claremont colleges who work alongside these community members to really promote health equity. And in doing so, we ultimately hope to really equip all of these individuals and communities with the resources as well as the support they need to access quality health care. And on the side is our lovely team from this upcoming year. And yeah, we've grown a lot since then. Next slide, please.
All right, I'll go ahead and ask if everybody could please go ahead and drop your name, pronouns, college, year, and what your favorite fruit is in the chat. We would love to know a little bit more about you guys. Leadership will go ahead and go around and do the same while you're typing that out. I'll go first. My name's Trisha. I use she, her pronouns. I go to Pomona College. I am a rising senior. And I'm going to say that my favorite fruit is papaya, which I know is a little bit controversial at times. But Indian papayas are so, so good. I'll go ahead and pass it on. I'll popcorn it, I guess, to Jason. Go ahead.
My name is Jason, pronouns he, him, Pomona College junior. not my favorite food, but the food that's fruit that's more I bring it up all the time in House Bridges, which is kiwi. I never enjoyed it because it's always so sour, but I look forward to enjoying a sweet kiwi. I'll popcorn it to Jojo.
Thanks. You should try golden kiwis. They're really sweet and really good. I keep forgetting that we need to get you a kiwi, Jason. Okay. But yeah, so let me introduce myself. So hi, my name is Jonna again. I use she, her pronouns. I'm a rising senior at Pomona College. And I would say my favorite fruit in the chat, like by far, like my go-to is usually pomegranate. I think they're in season this upcoming like season, I think. So I'm really excited to see them at Trader Joe's. But yeah, ooh, I see a lot of yummy fruit in the chat, but I will pass it on to Lily.
Hi, I'm Lily again. She, her pronouns. I'll be a senior at Pomona. And I just think a classic for me is always strawberries, honestly. And usually like a chocolate covered strawberry is the best also. Yeah. Emily.
Yeah. So hello again. I'm Emily, she, her pronouns. I am a rising senior at Scripps College. My favorite fruit is probably mangoes. I look for all different kinds of mango desserts and you cannot separate me from them. Yeah. We'll go back to Trisha.
Awesome. My family has literally had like lengthy discussions about mangoes and like which ones are like the best ones.
I
But that's
really love
awesome.
Indian mangoes. My friend brought them to me this summer. They're so good.
Yeah. Yeah. Awesome. Okay. Well, let's go ahead and continue on. Thank you guys so much for dropping all of your favorites in the chat. I really appreciate it. Some very good fruit taste out there. I like it. And so I guess we'll go ahead and start a little bit more about specifically what we do and how you guys can get involved, which I'm sure is why you guys are here. So we'll be talking about the Health Advocate Internship Program that we run every year, all year, basically. And so the way that we have structured our organization, especially in recent years, is that we have 3 pods. We have our original pod, the Hospital Volunteering Pod, which was what we were founded with, what Joanna was talking about before, and it features our partnership with Pomona Valley Medical Hospital Center. Pomona Valley Hospital Medical Center. And so we have been there for a really long time, and Emily will tell you a little bit more about that going forward. But the focus of what we have done there for quite a long time has been the translation services that we offer, as well as assistance signing up for HPEs. We also have the 2 newer pods that have kind of burgeoned from all of the work that we were doing previously during the pandemic and post-pandemic, which are the educational outreach and the community partnerships pod. So we'll go ahead and talk about those now. And so one thing before we do is that oftentimes we recommend that health advocates volunteer at both the hospital in the hospital volunteering pod, as well as serve on 1 or 2 of the other pods, the educational outreach or community partnerships pod. However, that is completely optional. You're more than welcome to only focus on working in the hospital, only focus on the educational outreach work or the community partnerships work, or any mix of them. So without further ado, I'll hand it over to Joanna to talk a little bit more about educational outreach.
Awesome. Thank you so much for explaining the overview. So I didn't say this when we introduced, but I was formerly this past year the educational outreach coordinator, who kind of oversees the pod. But essentially in educational outreach, we work I'm stumbling on my words, with local high school students to coordinate mental health, physical health, nutritional health, and overall wellness related workshops and events with our partners. Now, within the past year, so the 2023 to 2024 academic year, we worked with high school students from the Pomona Academy for Youth Success, a PACE program under the Draper Center, as well as Uncommon Good, which is also a youth mentorship / community, overall community organization in the Claremont community and bordering regions. And a little bit about what we've done this past year. So for our past fall semester, we did community building days with the PACE students, so 10th, 11th, and 12th. And it gave students really a chance to engage in intentional self-care techniques. We did, for instance, painting and conversation circles. We did a restorative yoga and mindfulness activities. We have a picture in the corner. That was a really good workshop. And we also worked with the 12th graders to talk about college mental health while making bracelets and eating ice cream. And then with Uncommon Good, we had stress management and a mental health workshop with their 10th and 11th graders. And then in the spring semester, we actually, for the first time, started engaging with the parents of those students, beginning with their cafecitos, as they call them. And we had 2 workshops with them. We worked with the 12th grade parent workshops to kind of discuss about mental health and navigating dialogues of mental health with their students, as in particular to those parents, their students were going off to college. We also had a nutritional workshop with the 8th graders, so we're starting to work more a little bit with younger groups, but that was our first workshop and it went really well. And we worked with the PAYS 11th and 12th graders to do a little bit of extensive activities. So honestly, if I had to summarize it, it's interactive ways to kind of engage dialogues of health and resources to get those to learn more about health for these youth. Now, next slide, please. Now, this upcoming year, we have a lot of exciting things. So with PACE, we'll be continuing to facilitate health-related discussions with these students, touch upon topics such as college adjustment, time management, self-care, and mindfulness. We're also continuing to work with Uncommon Good to provide similar topics, slightly different, but more interactive and engaging workshops, learn more about outdoor and nature learning, just based on the survey responses that we've gotten from students, and having an emphasis with social and emotional growth. We'll also continue to work with the parents and the 8th grade groups as time goes on. And more recently, we were funded to be able to coordinate the Preventative Health Education for Youth workshops, or FAY for short. And it will be a 13-event year-long workshop series that will focus on mental health, physical health, and have a specialized focus with nutritional health topics. It will be hosted at downtown Pomona, the PCAC space as we call it, but Pomona College Community Engagement Center for the full name. And we'll be collaborating with local organizations and health professionals to help deliver these topics to the students, as well as connect them to local resources. And we're hoping to engage these students in these materials to contribute to a community or tribal cookbook as kind of an end goal for these workshops and apply what they've learned from those workshops. So yeah, a lot of fun stuff. And I'm more than happy to answer any questions that come up in the chat or in Q&A as we kind of roll to talk about the other groups, but we'll talk about CP next. Lily or Trisha, take it away.
Yes, so for the community partnerships pod, I think it's important to note that the focus is a little bit less highly focused in as the educational outreach pod, in that this is also one of the spaces that we can use to build and grow and strengthen really amazing new partnerships that we've formed in the past couple of years. And so a couple of the most recent new partnerships that we have developed have been with the community health organization MALO, which stands for Motivating Action Leadership Opportunity. It's a community health organization that is run by and serves Tongan American people in the Inland Empire. And we've been really fortunate to have worked with them on several different projects over the past several years. Some of those including the Malo Gesina Health Fair, the Tongan CHW spotlights and nutritional social media campaigns, as well as traditional medicine campaigns, the Talanoa dialogue and publication. Talanoas are essentially kind of different. It's a very specific culturally specific form of dialogue. And we have been working to compile different publications relating to some of the different themes that we pulled from those dialogues that we really wanted to highlight. In addition, we have a relatively new partnership with Park Tree Community Health Center, which is a local federally qualified health center that we have started a social needs screening and food distribution program and we are this year kind of expanding and building on this program with some additional funding that we received to build and expand the social needs resource network, which Lily will talk about a little bit more going forward. In the past, we've also started a speaker series on gender and health with 10 speakers. Before that, we had a speaker series on, I think it was health inequities in Southern California. And we've also had other partnerships with Joslin Senior Center and the USC Street Medicine organizations, with whom, with the USC Street Medicine organization, we were able to fundraise money in order to gather supplies for people, for the patients of USC Street Medicine, who were often people who were unhoused. And so, kind of a lot of different partners that we've had over the years, a lot of different projects that we've done. So as you can see, the work that the Community Partnerships Pod does is a lot more varied. However, we do have some specific goals for this coming year, which Lily will be talking about.
Yeah, so first I'll start with Malo, which Trisha explained a bit. But we're hoping to continue our project called the Talanoa Publication, which essentially is a few different themes that we've pulled from past Talanoa dialogues and compiling them into a series of mini writings or articles that really highlight the voices of the community health workers that we talk to and also other community members that are associated with Malo. So some of the past topics we've done are like food and nutrition and also mental health. So we're hoping to continue that and continue writing that and putting it on Malo's website. And then we're also hoping to plan some youth summits and youth workshops to discuss and learn about mental health with the youth at Malo. In the spring, we're hoping for a larger summit. In the fall, we're doing mini workshops and then having a bigger event in the spring that continues with the theme of youth mental health. And then for the past couple of years, we've organized a health fair called the Casina Health Fair with Malo, which has provided information and resources about different health topics. And it's just been super fun in the past and a great way for everyone to kind of join together and talk about different health issues and work together to try to improve health outcomes for Tongan Americans, specifically in the Inland Empire. So we're planning on that for the spring again. And then Malo has some surveys with data that we're hoping to analyze and kind of put in a report with some visuals and some writing as well. And then we're hoping to just support Malo and their social media projects. And then also have another Talanoa dialogue with Malo's community health workers in the fall. Yeah, and then I'll give Trisha the floor for Park Tree.
Yeah, so like I mentioned before, we have received some more funding for specifically this project. And so we will be continuing forward with our monthly social needs screening and food distribution program, which we established last year, which essentially is going to Park Tree's site once a month and offering food distributions from another local organization called God's Pantry. And in addition to that, we'll be doing essentially having intake forms for patients to indicate whether or not they would like to learn a little bit more about different social needs, so that we can help connect them better with different resources. Along that vein, we are also working to build a more comprehensive and extensive social needs resource network. And so part of that has involved so far reaching out to different organizations, trying to build a longer term partnership with them, following up with them, and also hopefully hosting several different mini resource fairs, I suppose, at Park Tree to highlight and bring organizations that serve very specific social needs to Park Tree so that they are a lot more accessible to the patients. We'll also be trying to do some other miscellaneous projects to serve patient needs, and we'll discuss that more when the time comes. And back to Lily for the speaker series.
Thank you. Yeah. So also we have another ongoing project, which is called our speaker series. So we bring experts on health equity to speak with students and faculty at the Claremont colleges. So this year our theme is race and health. So we're hoping to have about 10 speaker events similar to last year. And most of the work on this project is speaker outreach and facilitating the events. So yeah, that's a bit about what we're doing for CP in the upcoming year. You can drop any questions in the chat and we'll also talk about it after for Q&A. Over to Emily.
Perfect. Thank you so much, guys. So I'll be talking a little bit about our hospital task at Pomona Valley Hospital Medical Center, which is a hospital that is roughly a 10-minute drive away from our campus. Our primary role at PVHMC is to provide translation resources and help with insurance enrollment for low English proficiency and low SES patients at the hospital. Our current responsibilities for our volunteers are weekly 4-hour shifts at the hospital. So after completing an onboarding process with the hospital, you would go to PVHMC with a partner for these shifts. And our responsibilities during these shifts include enrolling eligible patients into hospital presumptive eligibility, which is a temporary form of Medi-Cal insurance to cover patients' hospital costs. And some of the patients we work with will also require translating services to complete the HPE forms. Another task that we complete at the hospital is providing translation resources and interpretations with patients at the hospital. And we will also be piloting a new aspect of our program, which is becoming more involved with PVHMC's waiting room and emergency department. So currently we have a list of patients that we are given to see, but now during our downtime at the hospital, we are planning to just hang around in the waiting room, see where help is needed, and especially continuing to help with our roles of translation and insurance enrollment at the hospital. I will also be answering any questions about that at the end, or Jason can also help with that. So now that we've given a brief overview of all of our 3 pods, we'd just like to talk about the application requirements. So for eligibility, Health Bridges is a program that is open to all 5C students. For the hospital tasks specifically, we do require students to have completed 1 semester of college. This is just because the hospital task is one of it was our founding pod, our longest standing partnership, and we just hope that our volunteers are more comfortable in their college lives, more settled in before onboarding them into the hospital. For our application requirements, language or speaking another language is not required, but it is preferred for our hospital task. The majority of patients that we work with at PVHMC speak either Spanish or Mandarin. However, we also do perform translations for Vietnamese and Korean as well. Lastly, for hospital advocates in the hospital task, you would be PSIP eligible if you are a Pomona student. If we do accept you into Health Bridges, we would walk you through the entire process of applying for funding to cover the costs of travel to the hospital. The application link, I believe all of you, if you've received the Zoom link, you should have also received the application link, but we'll have one of the Health Bridges leadership team members drop it in the chat as well. And finally, for the application process timeline, well, you've already completed 1 step by attending the info session here. So if you had not attended, we would require you to watch the recording of this information session. But our application deadline is August 30th at 11:59 p.m. During this time, we also require you to email a resume to our Health Bridges email, which is seen on the screen. And anywhere between like a couple days to a week later, we will contact you regarding the status of your application, whether or not we will invite you to an interview. And in that email, we will coordinate times between you and a couple of interviewers within the Health Bridges leadership team. And then decisions will be released sometime on September 7th. Yes, so that is the application timeline. We understand that it's quite early in the semester, and we thank you for being accommodating for that. We just want to have our full Health Bridges team ready within the first month of the semester starting so that we can begin all of our projects and all of the cool pods that we have here. And lastly, we have our website, Instagram, and email. Please follow us. Look into our website if you need to refer to any information about our individual pods while applying. But yeah, I will go ahead and stop the recording and then open the floor for Q&A.